Hi everyone, and very good evening to all of you. A very important session for counseling. So, first of all, I'll talk about myself. So, I am Dr. Praveen Kumar, and I am faculty of pathology in DBMCI. I have been teaching this subject for the over, I think it has been now 9 to 10 years now. Uh, I have met a lot of students, and meeting them always makes me so special. Very good evening to all of that special feeling is only because the interaction has been so superb over the years. And now, when you've got a rank, guiding you throughout the next path, that is taking a subject. You always say that when you take a subject in the PG, you always marrying a subject. So, why do we say that? Because ultimately, you have to be with that subject. You have to be, you have to spend the entire life with that. So, that what makes you marrying a subject. So now guiding in the next session as to what subject should you take, or as a career option of pathology, how it should be. I'll try to answer all your queries. Whatever you have, please put in the chat box below. I'm watching all your questions also. And in the meantime, before I start there, I'll talk about first of all this pathology subject as such, and I'll also talk about transfer medicine in a while. But most importantly, the core of the entire discussion would be the paraclinical subjects, and not only pathology, it should also be consisting of microbiology, biochemistry. Pharmacology is completely different altogether because those are not diagnostic fields. But when you say diagnostics, it means biochemistry, it means microbiology, it means pathology, and the whole thing, holistic approach, is called as laboratory medicine. So laboratory medicine actually is it's also only a branch that is actually available at AIMS. However, the different parts of this, is like core pathology, core microbiology, and the core biochemistry. Since I have been given this opportunity to talk about the pathology, so I'll talk about that first. But if you have any questions, any queries, please put in the comment box below. I'll take them as I'm talking to you. So number one, first of all, when you have chosen or you're actually thinking about taking pathology, the few things I'll talk about first is, first of all, make your mind that this is a paraclinical subjects. So you will be going completely out of touch to a patient. So if you can do that, I welcome you to this wonderful branch of pathology. So first of all, just cross the stage when you are thinking patients versus no patients. So if you can, if you can stay your life, you can dedicate your life for solving the queries of the patient. This is a branch. Why I'm saying so? So देखो, as such, pathology has a huge scope. When I say huge scope, I will just talk about the scope not only in the private fields but also in the core and government medical colleges. So as a government medical college, after you do an MD in pathology, you may do an SRship, that is a post MD experience. And post SRship, you can do DM. You can also be a assistant professor. You can be entrepreneur. I think that is the biggest charm of the subject. You are a core entrepreneur, and if you want to do that, no one can stop you, right? Over the past few years, when the evidence-based medicine has taken such a huge chunk of the entire treatment profile, the pathology as such has even grown completely, not only from the cytopathology and histopathology point of view, or a clinical pathology point of view, hematology point of view, but the molecular diagnosis has completely changed the way of approaching the subject. I have seen a lot of pathologists now being entrepreneur. That means they don't completely go into the private field. They don't completely go into the government field. So they choose to become entrepreneur. They choose to become a businessman. And obviously, everyone cannot be as big as the Lal Path lab. But yes, even a small pathological lab will actually give you a huge satisfaction, and the patient that you cater, they all will always be depending upon your reports. So how does the entire field works like? The entire field is first of all learning the subjects in your MBBS career, so a post MBBS career. As such, when you are in second year, you don't see a lot of cytopathology and histopathology. You just know a few of pathophysiology, you know a bit about the diagnosis part, but when you come to the actual field, it's very different from those. So I will ask you, I will request you, I'll tell you, I'll advise you a few things. Number one is, choose pathology in a college that offers you a good amount of cytopathology and histopathology. If at all possible, that college should have a bit exposure of the molecular medicine. Now, because I'm saying so, because the exposure to PCR, the polymerase chain reaction, the RT-PCR, or the sequencing is very, very important nowadays if you want to open your own department. And the department can be in a government medical college, it can be private medical college, it can be your own hospital, or it can be a simple setup of a laboratory setup. So basically, first of all, choosing the subject is important. And secondly, where you do it from is also very important. So I'll talk about the good institutes where you can actually pursue it from. But once you have taken a subject, there's no looking back. Because if you suppose take the subject and again prepare for 1 year, that 1 year of first year JRship will actually change the how you look into the subject. You will not be as interested as you can. So I was one of those candidates in my entire batch. When I took it, I completely believed on it, and I ensured that I will know every diagnosis I can, right from clinical pathology, right from microbiology, right from clinical hematology or cytopathology, histopathology. So I was sure that I will pursue the subjects. So what happens sometimes is students often take the subjects and they keep on preparing. That 1 year is gone, and the final year is always for a PG. Is a PG always he wants to write a thesis and then comes the exam. So only left with the second year. And in the second year you have multiple postings which is also your department. It may be in blood banking. It is often in the molecular medicine. It is often in the clinical pathology and all those. So the point I want to make here is, once you take this subject, first of all make your mind whether you want to pursue this or not. Just don't take it only for the sake of taking it. So I would request you, if you're just taking the subject just for the sake of taking the subject, don't take it. Don't take it at all. Wait for 1 more year and do something else. But once you made your mind and then you start taking the subject, you will actually love the subject. Why so? Because you have seen a patient. Yes, you can see a patient because you are taking the biopsy, or if you are doing a FNSC, you have seen the patient. Now looking into what is in the tissue of the patient is really a charm. But that charm is only when you love the subject. Else, you will never get that thrust. You'll never get that force to learn the subjects. So, once you have made a career choice, okay, I can do pathology. Right from day one, just be focused. In the focused point, you must learn a lot of things. Because when you see histo, that is histopathology, you learn a lot about cytopathology. And that also goes vice versa. But apart from these two things, there's also a very important concept of hematology nowadays. Hematology is often seen in two headings. Number one, it can be clinical hematology. It can be hematopathology. So in many of the states, for example, in West Bengal, the DMA in clinical hematology is also available for one who does a MD in pathology. And the histopathology as such DM is often with PGI, and or even the PGI in Uttar Pradesh, the PGI. So SGPGI, what you say it. So both of them offers the DM in histopathology. Apart from this, you can do a DM in genetics. You can do a DM in clinical genetics, I should say. So all these courses are offered as a super specialization course if you want to go for it. Okay. However, if you want to stick to the core subject and you want to pursue it, I can tell you, out of all the paraclinical, this is the branch you must take. Why? Because as a pathologist, you can sign multiple reports, not only of the clinical pathology, clinical biochemistry, clinical hematology, but you can also sign the reports of the higher centers, for example, the PCR, the HPLC, karyotyping, and all those you can sign off. So I think if you at all want to go for the subject of, I'll say, paraclinical, this is what you must choose. But choosing it from the right college is again very important. So what is the approach to choose the right college? So to choose it, I must tell you, first of all, go into the state, and in the state, choose the state capital. In the state capital, you must see how good is surgery, because if the surgery is good, histopath is always good. And always important, who is the head of department. So I don't think you will get so much information, but if you want to choose it, please choose it from the state medical college capital city. Okay, that is a golden rule of taking pathology. Apart from that state medical college, you can always opt it from a university which is actually a central based institute. Now, central institute means it can be, I'll just list out the institutes. So usually the trend in Delhi is, if you don't go for MAMC, you go for UCMS. UCMS is a very good college for doing MD pathology in Delhi. TMC Mumbai is very good college. SGPJ Lucknow is again a very good college for doing that. And then comes so many different institutes which can be, right from, it can be the MAMC, it can be Lady Harding, it can be the Mumbai Medical College. All of this are the options that is quite open. About the DNV course in pathology, again, it is very important because see, DNV as such, when you say DNV, you always get into in the setting that the surgical feats in DNV, you may not get as much good as cutting. But always the DNV in a private medical college or private hospital is always very good. Why? Because the reporting has higher standards. They often go for complete immunohistochemical stains and come with a complete diagnosis, and it often happens very quick. Compared to a government medical college, it takes a lot of time for reporting. So you may just lose the continuity of the reports. So taking it from a DNB, opting a DNB from a good hospital, a central institute, like for example, any good hospital in Delhi is a very good idea, and I'll make a separate video of what are the good institutes for MD and DNB as a separate heading. Today we'll talk only about the pathology subject as such. Okay, a few things also about MD transfer medicine. Yes, so they go MD transfer medicine is what? It's all about blood banking. So if you talk about the MD transfer medicine, it is you are restricted now to practice the blood banking, which I'm not saying it's at all a subject that you should not opt. Obviously, every subject has its own charm, and every subject will give you the return that you want to, because ultimately it all depends upon how good you are. It doesn't depend on what subject you take. It all depends upon how good you are. So actually speaking, I'll just talk about this. Yeah. So actually speaking, so any subject is good if you pursue it to your best interest. MD in plasma medicine will restrict you to the blood banking, but blood banking is a very good field. It also has immunohematology. That means you look into the antibodies in a patient, you diagnose the irregular antibodies, you actually look into the right type of blood to be given to the right type of patients. Apart from that, not only of the blood banking, you also look for the complete plasmapheresis, which is a growing field, especially in those hospitals which have evidence, or those have facilities for the organ transplantation. So plasmapheresis is again a very good core branch nowadays of the MD in transfer medicine. So that is a very good branch. If you want to take it, I think you should go for it. But again, taking from the right institute is very important. So I would suggest you, if you have got a rank around 10,000 or below that, go for a central institutes and opt for that in that hospital only. So if you're happy for NICT, take it from the AIMS or the AIMS-like institutes, or from the PGI you can take it. SGPGI is a very good institute, and similarly all those good institutes which are actual central institutes will offer you the branch of MD in transfer medicine, but it has a bit limitation. Why I'm saying limitation? Because so when you do an MD in pathology, you are eligible to become a blood banking officer. A blood banking officer is also a person who has done his MBBS and has taken 1 year, only 1 year of experience in the blood banking. But if you want to become an assistant professor in blood banking, then you should have either an MD in transfusion medicine or you should have MD in pathology. No other things is actually applicable. So if you want to pursue a career in blood banking, so MD pathology is again a good rule. So that is also will serve you to take the MD or you can practice blood banking as such. But if you do a blood banking, that is MD in transfusion medicine, then you will not be able to practice the pathology as such. Achha. Sir, also talk about the scope of microbiology and pharmacology. So, the pharmacology as such was a very bright field in the past few years. Over the few years, there has a lot of fighting. I'll say it has almost become a bit crowded there. So, pharmacology, I'll say, is a good option, but only when done in a good institute. Otherwise, pharmacology nowadays has become a bit of more crowded. Microbiology is a very good field. If you want to take it from a good institute, I'll tell you, take it, microbiology, because microbiology is a complete core field which no one else can practice. So only a core microbiologist can practice a microbiology, no one else can, because it's a lot of things which is complicating in an organism, right from the bacteria and the fungal and the parasitic. I don't think any pathologist can do that. So microbiology is a very good field. Yes, the scope is a bit limited because of the lot of crowding happening there too, but crowding is everywhere, right? The crowding is also in medicine, crowding is also in anesthesia. So don't look at the crowding part, look at what you can do with the subject. So if you want to pursue it with the right approach, take it, don't worry about it. Achha. So how is MGM Indore for MD transfer medicine? See, any state medical college hospital is good, especially taken from the capital city. So if you're not getting that, then the other cities are good, quite good. Indore Medical College as such is very, very good medical college, right? It is very good also for the surgical disciplines and also the medical disciplines. Right from that, the blood banking automatically becomes very good. Okay, so you can obviously opt from it. Sir, what is the chance of getting my diploma in clinical branches at 38.5 rank? So, beta, if you want to go for diploma, I would suggest you to go for DNB degree. Don't go for diploma now. So, what about emergency medicine? So, emergency medicine is also a very good career choice, especially nowadays. You know why? Because every state hospital should have an emergency medicine department nowadays. So, those candidates who are doing emergency medicine will surely be absorbed there. And maybe because the MD in emergency medicine is not very common, so you will surely be heading that area. So that gives you a very good approach of approaching not only the core medicine, but also surgery, orthopedics, and all those emergency casualties are the first. You are the person who look into that. So that has a very good scope. Okay, MD in physiology. Now that requires a quite interest there. So MD in physiology has a very good career choice when you do a PhD in physiology also. Otherwise, see, any of such degrees will always have good career choice if you want to go for the assistant professor job. There is a professor, assistant professor, associate professor in the medical college. So that arena is always open for you. There's no doubt about it. So MD in physiology is also a good choice, but you should have interest in that, right? Okay. So diploma OBG worth to do? Yes, देखो, Obs Gynae is a branch which is always evergreen. So Obs Gynae, I'll say you get it, you take it, it'll always do good in career. But obviously you should have interest in that. Don't take it just for the sake of taking it. So what is better, Tata or Delhi Medical College? That also depends on from which area you are. If you're talking about pathology, so Tata Medical College is a very good college in Mumbai. TMC Mumbai is very good. Over the college of Delhi, I'll not say it is at par or above or down, but it quite depends on which area you are from. So if you're from Delhi, take it from Delhi. If you're from the area of Maharashtra, take TMC Mumbai. But if you ask me, sir, please rank the college, I'll say UCMS is very good and TMC comes the second in order. MD pathology in periphery versus DNB pathology in Delhi. Well, DNB pathology in Delhi, no doubt about it. Okay. Reservation for NEET PG. Yes, that's a big thing. I'll not talk about that right now because there's some other students. Let's talk about that first. Okay. Sir, I'm confused between MD anesthesia and DNB respiratory medicine. But DNB respiratory medicine, if done from a good hospital, is a very good field because you will always be in touch of a patient. So first of all, make your mind. Can you approach your life from here onwards without seeing a patient as such? So if you can, take anesthesia. If you can't imagine yourself away from the patient, take DME respiratory medicine. But both of them have very good opportunities, and if done from a good hospital in Delhi, that is what is very good. MD pulmonology or DNB medicine, again, so I'll say DNB medicine. DNB medicine, no doubt about it. Okay. So DNB surgery, can I get DNB surgery at 17K rank? Yes, Manik, you may surely get it. The point to understand there is the DNB surgery should be taken only from those hospitals in which you have good cuttings. So please, before you take it, first of all, ask those candidates who are doing DNB there and ask how much cutting they are getting, because the last 2 years have been a COVID scenario and the surgical fields are actually got dried. So now when the surgical fields are getting up, probably your seniors will be getting the cut, not you. So think before you take the DNB surgery in those hospitals. What about the scope in MD biochemistry and MS anatomy? But MD biochemistry, obviously you will sign the reports of the biochemistry, but the problem of biochemistry is you can sign the report of biochemistry also if you're a pathologist. I hope you got the point. But the scope of the MD biochemistry or MS anatomy is good if you are inclined towards taking a job of an assistant professor in a government medical college. So if you are able to do that, if you want to do that, there's no better branch than this. It's a very cool branch. You go to the hospital, you go at 9 o'clock, you come back at 4 and no tension at all. You play cricket, you play tennis, you enjoy your life completely. No tension at all. Because even if you just earn more, you have you will also want to earn more and more, and your life will completely go in a wayward. So if you want a cool life, if you want a satisfied life, take it. Not thinking about it next all. But what do? You do it with the right approach. सर मुझे रिजर्वेशन की वजह से पेरिफेरी मिलेगा मेडिसिन में, सो व्हाट टू डू? इफ यू आर एक्चुअली टेकिंग आई वांट टू डू एन एमडी मेडिसिन एंड यू आर गेटिंग इट फ्रॉम एनी मेडिकल कॉलेज, टेक इट. Always take it. Do not take anything else. At 17K rank, what can I expect? 17K rank, you will surely get good medical colleges and good institutes. So you will get MS Ophtha, you will get, not in a good institute obviously, but you can get MS Ophtha, you will get MS ENT. Starting with pathology is also a very good branch at 17K rank. How is MD-PSM in a good career option? Yes, MD-PSM is always a good career option. You have to look into various, the various, I'll say, national policies is often framed with the help of MD-PSM, and those make a very integral part of those, those areas in which there is a policy made approach for any health policy in the government. Okay. National Institute of TB for respiratory medicine is very, very good. If you want to do it from that, it's really a good choice. General surgery in a deemed or private medical college, which is better. देखो deemed and private, what is the difference? A deemed medical college is something which has a more autonomy compared to a private institute. So if you can afford taking it from a deemed institute because they're more expensive, go for it over a private institute. What are the options of 3-year MD pathology in DM? So can you please be more specific? So the options, okay. So for a DM, I told you the 3 options. One is a clinical hematology, one is hematopathology, and one is histopathology. Apart from this, you can also go for DM genetics offered by SGPGI Lucknow. So FCPS Dharma, obviously you can take it, no doubt about it. Where can I get MD pediatrics in 4128 rank, Sadhna? So for MD pediatrics at 4128 rank, I have to just check it, even though this is a career option for pathology. So don't tell कि sir आप ये सब क्यों बात कर रहे हो? But because you asked me, I'll just tell you. So taking this MD pediatrics at a rank of 4128, but it is quite tougher. But yes, you can get it from in Bihar. You can get it in the Bardhaman Medical College. You can get it. You can get it also in the Jorhat, Bhagalpur, Agartala. So all these colleges will be open for you for taking pediatrics. At 24,000 rank in NEET PG, what are the options? MD anesthesia in AFMC versus MD in pathology. So if you get MD anesthesia in AFMC, go for it. No doubt about it. Okay. एम से MD MS करने के बाद क्या बॉन्ड से बाउंड रहना पड़ता है? नो नो नो. एम से MD करो और अपने घर जाओ. All or any central institutes will never give you a bond. Right? They'll never give you a bond. The bonds are applicable only for a state medical college, not for a central institutes. Sir, does a college matter while taking PSM? देखो, college will always matter. Please don't be in that completely in a different life that your college will never matter. Taking it from the right college is the best thing you can do in your life for any I'll say any field. Sir, people who don't get clinical branch of the choice end up taking pathology. Is it wise to do so? Well, I told you at the first choice is first, can you spend your entire life without a patient? If yes, welcome to the branch of pathology. It's a very, very good branch. It's a very, very good branch. Will give you a good return, not only in terms of the money, but also in terms of the satisfaction that you actually get. So DNB pediatrics, neurology, should I take a risk of 6 years? This is a difficult one. So DNB of pediatrics is at that of 6 years is a bit tricky. 18,000 rank SC में dermatology मिलेगा. I am very sure that dermatology would be available at 18,000 rank in SC category. So can I do much of maxillofacial surgery after MSc-NT? Yes, why not? Surely, because you have done an MS there, you're sure to cut open anything above the neck. Okay. Sir, one DM pathologist from AIMS Delhi, she is spreading rumors on Twitter that she has 1.4 can bond. No. If you do, see, please understand one thing. So if you do a DM from an institute, and that DM you have got from a sponsored seat. So if you leave the sponsored seat, then you get into the bond category. Elsewhere, there's no bond at all. Prefer a Delhi Medical College for pathology. Surely I'll talk about that. That is what I'm here for. So usually, I'm not talking about the pathological college in Delhi and the choices you will go for. So for Delhi, usually the choices are UCMS, RML and MAMC is often taken together. Then comes VMMC, and then the Lady Harding Medical College. So is Andhra Medical College good? Yes, it's very good for pathology, especially I'll talk about two of the colleges. Number one is the Gandhi Medical College, and the Osmani Medical College is very, very, very good. If you get it in Nizams, it's also very good college. There's no bond beta from AIMS. If you do any degree, you have no bond. मैं एम्सोनियन हूँ, मुझे पता है. There's no bond at all. So don't believe anything else. I'm an Amsonian. I know what is AIMS all about. Can I get MD medicine in Government Medical College Maharashtra 25K rank in PWD category? Yes, you can. I'm interested in general surgery, but for my rank in MS ENT will be quite easy. Will there be scope after only ENT? Why not, beta? अरे क्या बात कर रहे हो? Doing a MS or MD in any field is worth doing it. Please understand, anything you do in life with a good dedication will always give you good return. Please don't go into that fact कि अगर मैंने MS anatomy किया, अगर मैंने MD biochemistry लिया, मेरी लाइफ खराब हो जाएगी. ऐसा नहीं है. You do anything in life with a good dedication, it is worth better than doing a MS MD medicine without having that interest in that. So do something which you have a passion for. So if you have a passion, go for it. It'll surely give a return. I can guarantee you that. Diploma OBG government versus MS Obs Gynae private. So MS Obs Gynae private. If you can afford it, take an MS. So because why so? Because देखो if you when you practice outside, see देखो, first of all, there's something called as MD, there's a DNB, there's diploma. Now suppose there is a seat advertised in any medical college, or the seat advertised in any supposedly private hospital. First of all, they'll choose MD, then they choose DNB, and then they go for diploma. So why do you want to be the third person? If you have an option, you can afford the MD. If you can afford it, go for MD or MS. If you can't, then go for DNB. If you cannot, then go for diploma. The DD medicine from Northern Radio Hospital, that's a good choice. I can say that's a good choice. You can take it. You can surely take it. Okay. Now, I also have talked about a bit about the MD in transfer medicine. So if you're getting a transfer medicine from any central institutes like PGI, SGPGI, or a Kozhikode Medical College in Kerala, take it. It's a good choice to have, because ultimately all the blood banking will be ultimately run by MD in transfer medicine. Okay? Why anesthesia branch look inferior, taboo in society? It's only in your head. It's only in your head. Anesthetists are the people who take care of critical medicine, and they are the one who actually run a hospital. So whether you think about that, you will have only in your head, because you have been taught in that way. But every branch is quite respectable, provided you shine on that. Well, sir, Delhi DNB surgery versus peripheral MS surgery, what is better? So I will go for the DNB in surgery will be a bit tricky, because you may not get cutting, especially when the last 2 years have gone for the COVID scenario, because all your seniors will be given more and more cutting rather than you getting it. So I'll suggest you not to go for the DNB surgery as the first choice. Go for something else as the first choice. So can an OBC candidate compete for your category seat in DNB? If yes, kindly suggest good hospitals for a 12K OBC category. But can you please tell me what is your choice of your subject? I can tell you that. Sir, is it true that you always good at teaching and has a passion for teaching, and you took MD pathology? No, beta. So I got a rank of 59 in AIMS, and my entire rank became 95 there. So I had no other good choice than to take pathology there. So the subject available at my time, I thought that this is the right choice. I was not getting clinical subjects at my time, so I took pathology, but I really have made good out of it. That is why I can tell you, I will be very true. I will not lie to you, because I never lie to my students. My students are my life. My students are my life. I have dedicated my entire life to the students. So I cannot lie to you that I took this subject because I loved it. No. I got it, I took it, and I made the best out of it. Okay. Please enlist one or more time name of Central Institute for MD Transfer Medicine, Beta SEMA. Those are, I'll say, there is For those which is appearing, for those who are appearing, it's SGPJ is a very good institute for that. BHU, if starting this year, will be a very good institute. Kozhikode Medical College in Kerala will be very good institutes, and anything in AIMS will be good along with the PGI institutes. So to fellowship, we want to take any exam like NEET SS. So yes, to do fellowship, you have to take the NEET SS. Surely nowadays, the things are changing nowadays. Okay. At 14.5 thousand rank, I get DNB Pediatrics in an average institute. MD Radiation Oncology is good or bad option? MD Radiation Oncology is a good option provided that institute or that medical college should have all the brachytherapy and the options of giving the brachytherapies. So you must first know about that college. You go, you ask them, the seniors who are taking it there, and then you opt it from there. ओके 18K SC डर्मा कौन सा गवर्नमेंट मेडिकल कॉलेज मिल सकता है प्लीज टेल सो एट 18,000 at SC dermatology you will surely get the college in Bihar, West Bengal, and you will also get it from Assam and also get it from the Maharashtra Medical College, not the main in the Mumbai but from the other medical college. You can surely get in the SC category. Sir, after doing MD pathology, can someone also teach in dental college? Why not? Achha, with his own lab, देखो, if you are running your own lab, then you will be able to teach somewhere as a faculty only in a private medical college, not in a government medical college. ठीक है? Because government medical college में you are not allowed to do a private practice. Okay. Scope of MD psychiatry. Psychiatry is a very good branch, but you should have that inclination. ठीक है ना? Please don't take a branch just because you are getting it. Think about it. Can you spend your life doing MD psychiatry? If yes, it will be a very good career choice for you. But if you think, I cannot talk to people so much, you cannot talk to your family. Suppose, if you can't listen to your family, how can you listen to your patients? That requires a lot of patience to listen to someone and solve it. It requires a lot of patience. So are you one of those? Take it. If you can't listen to yourself, you can't listen to your family, if you can't talk to your family well too much, why do you opt for it? So after MSENT to start a private clinic, approx budget needed? Well, I think we should ask MSENT sir, not from me. I'm aiming to compete for NICT. What is your options? I have a supportive family now. Dekho, beta, if you want to pursue the next coming exams, NICT or NEET 2022, I am with you. The entire faculty is with you. There's so many students because you are also doing mentorship of OTO mentorship. I hope you're aware of it. So the OTO member, we just tell the students every morning we meet at 8:45 to 9 o'clock, and we tell the students that we are with you. There's so many students preparing for them. So many students preparing for that. And every time we just tell them that you are not alone in the race. It is very common to feel that stress. But once you have decided to study it, we are always with you. It is just that you should have a right approach, you should have a right timetable, and you should follow it with full dedication. There should be someone who should push you. And I know if you want to do it, you'll surely do it. So MD transfer medicine turnover per month, it will be approximately 1 to 1.5 lakhs. Is it true to do a research is needed to become a faculty in government medical college? See, research is a part of your MD curriculum. So while you're doing a good MD in a good institute, you'll always be writing papers, articles, original articles. That original articles, as the number increases, you are a better runner for getting a faculty seat in any government medical college. That is why I'm telling you, take it from a good institute. Else, you will not be able to write good articles, and that will be a deteriorating thing in your career in MD pathology. Best medical college at 23K rank for MD pathology. So देखो इस समय क्या होगा ना, because the DNB and the MD counseling will occur together, so it will be very difficult to predict that. Okay, so I'll not be talking about at what will you get at your rank at 23K, because this year's the DNB and MD counseling will all go together. So what was happening the last year cannot be applied to you. But if you want to ask me, sir, please tell me the good medical college in this state, I can tell you that. Okay. So best college for MD pathology, as such, can you please list out the name of the state? I can tell you that wise. Okay. Scope of MD pathology, future MD pathology. I've talked a lot about it. If you watch this video from the starting, and I've talked a lot about what is the scope of MD pathology and what is the scope of research in MD pathology. What is the scope of DM in MD pathology? What is the scope of doing other fields in MD pathology? I've talked a lot about this in the beginning of this video. So if you talk about the best medical college for MD pathology, supposedly if you talk about Delhi, I talked about it's UCMS, then MAMC and RML often goes together. Lady Harding Medical College and Safdarjung Medical College is very good institutes. Okay. Now if you talk about the same thing in supposedly Maharashtra, so in Maharashtra for doing the MD pathology, it is TMC Mumbai, it is State GS, Grants Medical College, LTM Medical College, and the BJMC Pune are the good choices in Maharashtra. Prachi asking, sir, I have got 8,000 rank in NEET. I haven't prepared for IRCT. So if you start, can I get good enough to get MD practice in any aims? Surely, Prachi. Dekho, every day I talk to the students at a morning 8:45. I know it is very tough for anyone to pursue something. But once you have decided and you read continuously for daily 6 to 8 hours continuously, you will surely get a rank and seat of your choice in the next exam. But there should be dedication without any distraction. Dedication without distraction will surely take you to the branch of your choice. Okay, Kerala made top medical college is TVM or Calicut. So if you want to know about the MD pathology as such in Kerala, I'll talk about that too. Guys, if you have any other queries, please put me. I will be live there for 5 minutes more. So Thiruvananthapuram is a better medical college compared to Kozhikode and then Kottayam, and then comes the Thrissur. So Thiruvananthapuram, Kozhikode, Kottayam, and Thrissur are the good choices for doing in Kerala. Scope of entrepreneurship in pathology, but scope is scope. The day you do an MD pathology, you pass the course, next day you can open a lab. Well, it will run or not. The day you open a lab, ask me which instruments to buy, from where to buy it from, and how to run the institute in a good way so that you get the patient's satisfaction. I'll guide you there also. So good medical college for MD pathology in Karnataka. Okay, that's a good question. So for Karnataka, I'll talk about the Karnataka now. In Karnataka, the usual choice is BMC Bangalore, then comes the Mysore Medical College, Hassan Medical College, and the KIMS Hubli are the good choices for doing MD pathology there. In Bihar, Jharkhand, UP, Gujarat, so देखो Bihar में it is Patna Medical College only. In Jharkhand, there's only one college. You can obviously operate from the RIMS. UP में lot number of colleges. बहुत सारे colleges UP में. I'll just list out them in the decreasing order of choice you can take. So in Uttar Pradesh, in UP, you can take it from the SGPGI, King George Medical College, IMS BHU Mumbai, IMS BHU Varanasi. Okay, so often the options are SGPGI, then KGMU, then BHU, and then comes the RML. Okay, but then RML is also a very good institute because it's a central institute, so you can also take that at the first. Okay. Sir, we have only 15 days for NSAT. Surely, Rami, I'll make a separate video out of it and upload very soon in my own channel. So please wait for it. I'm actually waiting for just this day to finish. I'll just upload it in tomorrow only. Okay. So how do you decide? That's a good question. So how do you decide on a life choice between an MD pathology, between a faculty of a medical college, setting a lab, or being in a coaching? It all happens while your life is going on in MD. You meet people, you meet good people. Some people will guide you and some people will just shake you out from your path. So stay with those people who actually guides you, who give you good advices. Talk to them and talk to them a lot. While you're doing the MD, you meet people who share their own experiences. And based on their experiences, you make the right choice for your own life. सर दिल्ली और एनसीआर में डेली पीडियाट्रिक्स गुड हॉस्पिटल्स. Okay, this is a very different, completely different question altogether. But PJMR Kolkata or MD Path? How is PJMR Kolkata? It's very good institute. SSKM is a top institute for doing an MD pathology in Kolkata. It's a top institute there. Okay, guys. So I think I was able to solve a lot of questions for you, but I'm always available for you. You may ring me in Telegram. Please join my group and let me know if you have any other doubts, and I'll be able to solve it there also. About how to go for I9CT, how to go for the NEET 2022. I'll make a separate video. This is not the right time to talk about that because this was completely a video made to discuss the scope of MD pathology and the allied fields and how to do best out of it. Wishing you all the best. Take care. Goodbye and very good night to all of you. If you have any other doubts, please put in the comment box below and I'll be able to solve it after the video ends. Okay? Goodbye. We wish you a happy Diwali, that is in days to come, and make a right choice for your own life. Okay? Goodbye and very good night. Bye-bye.